Hi, Nathan Stickney at Foot and Ankle Associates of North Texas, and I'm going to talk to you about what's called Freiberg's disease. Freiberg's disease is a condition you develop in the foot and ankle when a certain bone loses vascularity. This bone can lose this vascularity due to trauma or any kind of increased pressure over time. Due to this loss of vascularity, the bone will develop what's called avascular necrosis. We generally see this in the second metatarsal, up here in the second metatarsal phalangeal joint. Freiberg's disease can be very painful. The symptoms that you see with Freiberg's disease is a limited range of motion when you move the second metatarsal phalangeal joint. You get a lot of swelling to the joint and a lot of pain. Trying to do physical activity can be very painful, not only under this joint, but on top of the joint. We see a lot of deformity in the joint when a patient gets avascular necrosis. So what you'll see is a flattening of the metatarsal head. You'll also see a lot of bone spur around the area and just degenerative changes of that joint. So when a patient comes in, we'll make this diagnosis by taking an x-ray of the foot. The x-ray will show us these conditions that I just named and the abnormal joint in the second metatarsal phalangeal joint. If we need to, we can also order an MRI or a CT scan that can better evaluate these joints to see the extent of the injury. The treatment options that we do for this is generally, Freiberg's will cause a lot of inflammation and pain in that joint. So a steroid injection into the joint is very effective. Also, we can get custom orthotics that will go in the shoe that we can offload that joint and make it feel a lot better. Icing the joint, taking anti-inflammatories are very effective. Physical therapy can also be very effective in this. If conservative treatment does not work, there are 3 options for surgical treatment. The first option is going into that joint and just cleaning the joint up. Taking off any kind of bone spurs that are there and kind of reshaping the metatarsal head to a more appropriate shape. The second option is going in and putting a joint implant in there and replacing the joint completely. This is the same thing that you would do if you got your knee replaced or your hip replaced. The third surgical treatment is cutting the joint out. So what we do is we remove this joint by cutting the knuckle out. By removing this joint, it gets rid of all the pain and inflammation of the joint. If you have any of these symptoms, don't hesitate to call and come into Foot and Ankle Associates of North Texas.